People think depression is sadness. People think depression is crying. People think depression is dressing in all black all the time. But those people who think that are wrong. See, depression is a constant feeling of being numb. Being numb to emotions, being numb to lie. You wake up in the morning just to go back to bed again. Days aren't really days, they are just annoying obstacles that don't need to be faced. And how do you face them? Through medication, through drinking, and through cutting and harming yourself in any other way. When you're depressed, you grasp onto anything that can get you through the day. That's what depression is. Not sadness or tears. It's the overwhelming sense of numbness and the desire for anything that can help you make it from one day to the next. So what exactly is depression? I'm going to give you a few myths and a few facts about depression, and I'm going to point out why they are myth and why it's wrong kind of thing. Myth 1. Depression and bipolar disorder are just states of mind. A person just needs to think positive and they will go away. See, depression and bipolar disorder, which is also known as manic disorder, are real, treatable illnesses that affect the brain. They can't be overcome by snapping out of it. Asking someone to think positive is like asking someone with diabetes to change his or her blood sugar level by thinking about it. People with mood disorders can feel better with the right treatment. Myth 2. Treatment is a cop-out for people who are too weak to cope with day-to-day life. Seeking treatment is a choice that takes a lot of strength. Mood disorders are not flaws or weaknesses. Seeking treatment means a person has the courage to look for a way to feel better. Myth 3. Talk therapy is just whining about problems. It doesn't help. Talk therapy has been tested clinically and found to be quite effective. In some cases, it works as well as medication. Good talk therapy helps change behavior that can make a person's mood less stable. Personally, it has helped me. It has helped me a lot, and I'm thankful for talk therapy. Medications that treat mood disorders are habit-forming. They can change a person's personality. A person can't be clean and sober while taking medication. When properly prescribed and used, medications are not addictive and do not change a person's true personality. Medications can help a person's mood become more stable and even. They are not happy pills and should not be compared to street drugs. They are not street drugs. They do not cloud a person's judgment or cause a false sense of courage. Myth 5. People with mood disorders can't get better. What? See, when correctly diagnosed and treated, a person with depression or bipolar disorder can live a stable and healthy life. Millions of people already do. Myth 6. Symptoms of depression or bipolar disorder in young children or elderly adults are normal. They are just a part of growing up or growing old. Are you serious? Really? Severe mood changes in young children or older adults should be taken seriously. Recent studies have shown that children may be affected by mood disorders as young as infancy. Little babies. Older adults are also known as a high risk for depression. Younger and older people should be given complete physical examinations and treated according to their individual needs. I'm going to give you more facts about this because those myths were just frustrated the frig out of me. Like, those are really stupid. See, depression is a mood disorder characterized by periods of extreme sadness. These periods are known as depressive episodes. See, depression is experienced by approximately 9% of Americans at any given time. While major depressive disorder is the most common, other types of depression also exist based on additional specific symptoms. Some types of depression are major depressive disorder, seasonal affective disorder, and postpartum depression. Some symptoms of depression include sadness or feeling empty, loss of interest in pleasurable activities, irritability or frustration, hopelessness, pessimism, change in sleep pattern, change in appetite, tiredness, loss of energy, and low self-esteem, guilt, and even, sadly, thoughts of death. Depression treatments vary with different people, so no depression treatment is right for everyone. But with treatment, most people are experiencing significant reduction in depression symptoms. To people who think depression is a choice, please think again. How would it feel to wake up and not having the emotional strength to face people? To think that time is just passing by with no real reason. To feel so alone even when you are sitting in a room full of people. To have to put on a face and hide your feelings because in your mind you think no one would care anyway. To lose friends because you can't find the strength to go out and you can't physically be happy. To cry yourself to sleep, hoping that tomorrow will be a better day. Then when you do, you are exhausted from the night before, and it all starts again. You try to hide your feelings, hoping no one would notice, and more. Now tell me why someone would choose that. Depression is an illness, not a choice. So please, please, please understand someone who suffers from depression. I really hope that this video helped anyone, even you, realize that depression's not some sick and twisted game that people are pulling on everyone. It's an actual illness, and there actually is treatment on this, and you shouldn't laugh at it or make fun of it. Harming yourself in any way through burns, cuts, just any type of abuse with that, like alcohol abuse, drug abuse, that is self-harm. Any type of that kind of harm, there's a lot of therapy. There's talk therapy. That's what helped me, and I hope just even this video helps you guys. So I love you guys. Stay strong, stay beautiful, keep that smile on your face because it looks pretty damn fun. So, I'll see you later. Bye.
My ship went down in a sea of sound. When I woke up alone, I had everything. A handful of moments I wished I could change, and a tongue like a nightmare that cut like a blade.